Physical decline in later life is often accepted as inevitable, particularly among women over the age of 60. However, while aging brings natural biological changes, the rapid loss of muscle strength, balance, and bone density is not entirely unavoidable. In many cases, the decline begins subtly. It may appear as stiffness when rising from bed, difficulty lifting groceries, hesitation on uneven ground, or the need to push off with the hands when standing from a chair. These signs are frequently dismissed as normal aging. In reality, they often signal progressive muscle weakening that, if left unaddressed, can compromise balance, bone health, and independence. One of the most common misunderstandings surrounding healthy aging is the belief that general activity alone is sufficient. Walking, for example, provides cardiovascular benefits and supports mental well-being. Yet walking does not provide enough resistance to significantly preserve muscle mass, strengthen bone density, or train rapid balance correction. This distinction is critical for women who experience accelerated muscle loss after age 60 due to a condition known as sarcopenia. Research indicates that adults over 60 lose approximately 1 to 2% of muscle mass annually, while strength declines at an even faster rate. Simultaneously, bone density decreases and osteoporosis becomes increasingly prevalent. It is estimated that 1 in 2 women over the age of 50 will experience a fracture related to osteoporosis during her lifetime. Despite these statistics, decline is not predetermined. The human body retains the capacity to adapt to resistance training well into older adulthood. When muscles contract against resistance, they stimulate both muscle fibers and the skeletal system. Bone tissue responds to muscular pulling forces by strengthening even in later decades of life. The challenge, therefore, is not biological inability but lack of targeted intervention. Rather than requiring complex or high-intensity programs, many women benefit from a small number of focused exercises that address essential systems of strength, stability, and neuromuscular coordination. 3 movements in particular offer comprehensive protection: the sit to stand, the standing side leg raise, and controlled single leg standing. The sit-to-stand exercise, sometimes referred to as a chair squat, is foundational. Although simple in appearance, it is one of the most clinically relevant lower body strength movements for older adults. This exercise activates the quadriceps, gluteus maximus, and deep hip stabilizers while also engaging the hamstrings, core musculature, and ankle stabilizers. These muscle groups are responsible for essential daily tasks such as rising from a chair, standing from a toilet, exiting a vehicle, and maintaining stability during forward movements. When these muscles weaken, individuals often compensate by using momentum rather than controlled strength. They may lean excessively forward, push off with their hands, or hesitate before standing. Such hesitation reflects the nervous system's awareness of instability and is often a precursor to falls. Clinical studies support the importance of this movement. Structured sit-to-stand training in women aged 65 to 80 has demonstrated significant improvements in lower body strength and measurable reductions in fall risk markers within a matter of weeks. The movement can be performed using a sturdy chair with attention to controlled descent and upright posture. Lowering slowly increases time under tension, enhancing both muscular strength and bone loading. Over time, repetitions can be gradually increased. Beyond physical improvements, the sit-to-stand preserves functional independence. The ability to rise without assistance is a strong predictor of long-term autonomy and quality of life. While the sit-to-stand strengthens forward and vertical movement patterns, it does not fully address lateral stability. Many falls occur not forward but sideways, when the body shifts unexpectedly due to uneven terrain, sudden turns, or external contact. The standing side leg raise directly targets this vulnerability by strengthening the gluteus medius and gluteus minimus, 2 muscles essential for pelvic stabilization during walking. During normal gait, each step briefly places full body weight on one leg. If lateral hip muscles are weak, the pelvis drops slightly on the unsupported side. Although subtle, this drop alters joint alignment and increases strain on the knees, hips, and lower back. Over time, this instability contributes to discomfort and impaired balance. More critically, weak lateral stabilizers reduce the body's ability to recover from side-to-side disturbances, increasing fall risk. Research involving women over 65 has shown that lateral hip strengthening significantly improves side-to-side stability and single-leg balance duration. These improvements correlate directly with reduced fall incidence. The standing side leg raise requires minimal equipment and can be performed while lightly holding a stable surface for support. Proper technique emphasizes upright posture, controlled movement, and maintaining toes facing forward to ensure correct muscle activation. Progression involves gradually increasing repetitions or slowing the lowering phase to enhance muscular engagement. The final exercise integrates muscular strength with neuromuscular coordination. Controlled single leg standing. Although often categorized as a balance drill, this movement functions as a neuromuscular integration exercise. It activates ankle stabilizers, quadriceps, gluteal muscles, and deep core stabilizers while stimulating proprioception, the body's internal awareness of position and movement. Proprioception declines gradually with age, leading to slower corrective responses during unexpected shifts in balance. Falls frequently occur not solely due to weakness but because of delayed communication between the nervous system and muscles. Research has demonstrated that reduced single-leg balance time in adults over 65 is associated with significantly increased fall risk within the following year. Thus, single-leg standing serves both as a training tool and a predictive indicator of fall vulnerability. To perform this exercise safely, individuals stand near a stable surface with one hand hovering nearby for reassurance. The non-supporting foot is lifted slightly while maintaining steady breathing and forward gaze. Short holds of 10 seconds can be gradually extended as balance improves. Advanced variations, such as briefly closing the eyes, increase proprioceptive demand, but should only be attempted when stability is well established. Together, these three exercises provide a comprehensive strategy for preserving strength and stability after age 60. The sit-to-stand strengthens primary lower body muscles and loads fracture-prone bones. The standing side leg raise stabilizes the pelvis and reduces lateral imbalance during walking. Controlled single-leg standing retrains the nervous system, sharpening reaction time and improving balance correction. Each exercise addresses a distinct yet interconnected component of functional mobility. Importantly, this approach does not require complex programming, heavy equipment, or high-intensity effort. Consistency, rather than intensity, is the determining factor. Short sessions performed several times per week are sufficient to stimulate adaptation. The emphasis is on targeted resistance rather than general activity alone. Preserving independence in later life depends not on resisting aging itself, but on maintaining the physical systems that support daily function. Strength, balance, and neuromuscular coordination are foundational to autonomy. The ability to rise from a chair, walk steadily, and recover from a stumble are not merely physical skills. They are essential components of dignity and self-sufficiency. While age-related changes are real, they are not beyond influence. The body remains responsive to appropriate stimulus well into advanced years. By incorporating the sight-to-stand, standing side leg raise, and controlled single leg standing into regular practice, women over 60 can meaningfully reduce fall risk, support bone density, and maintain the confidence required for independent living. The path forward is not extreme exertion, but deliberate, consistent resistance, applied thoughtfully and sustained over time.